Hi, I'm Marvin Plackett, and today is Wednesday, August 5th. Greetings to all residents, to all staff, to all guests. We continue to have 6 active COVID cases at this time. 1 resident, and that resident lives at King's Crossing, and then the 5 staff, of course, they are recovering at home, and we certainly wish everyone well. Tomorrow there will be testing in the Sister Annette house, because that is where the most recent staff person tested positive at Episcopal Church Home in the Sister Annette house. So that testing is the Sister Annette house is going to be retested tomorrow. That'll be all residents and all staff, Sister Annette house. And then tomorrow and Friday, there's going to be retesting of all residents and all staff who work on the 4th floor of the gardens, because at the gardens, the most recent staff person that tested positive worked on 4th floor. So again, that testing will occur tomorrow and on Friday. I want to refer to a article in front page article, today's Star Tribune. Minnesota's COVID-19 case growth now standing out. Positive tests in Minnesota top 5%, even as other hard-hit states start to improve. Now some of those hard-hit states, they still have colossal numbers in total compared to Minnesota, but as a percent, some of them are improving and Minnesota is increasing. Not a good sign. I'm just going to pick out some excerpts from this article. Minnesota's average daily count of new lab-confirmed COVID-19 cases has increased 11% over the past 2 weeks, while daily counts have declined 24% in Arizona and 16% in Texas. Again, in Arizona and Texas, they have much larger numbers in total, but as a percent, they're declining, whereas in Minnesota, it's increasing. The positivity rate of diagnostic tests also has risen from 3% in mid-June to more than 5%, a key threshold for whether states have manageable situations or excessive growth in COVID-19 cases. When people have to be indoors here because of the cold, so coming up in the fall, when people have to be indoors because of the cold, we're going to be at higher risk. I think the Midwest appears to be on the rise in general. Minnesota on Tuesday reported that 328 people were hospitalized for COVID-19, that 159 needed intensive care. Health officials, I mentioned a few days ago about the 250,000 people that are expected to gather at Sturgis for the motorcycle rally, which is just short of 2 weeks away, that there's substantial concern about that. The risks might, they're not, when you're just riding your motorcycle, that's not so great. You're outside, the air is filtering the possibility at that point. However, those 250,000 people are going to do something in the evening or in the afternoon or whatever, and they're going to go somewhere probably and be drinking and eating, and that's when the risk, of course, is high. Mike Osterholm, the director of University of Minnesota Center for Infectious Disease Research and Policy, said that I think Sturgis has every potential this year to be a disaster in terms of the COVID situation. And of course, are any of you going to be attending? Not likely. Staff, residents, probably not going to Sturgis. I know I'm not going to Sturgis, but there will be people from the Twin Cities going to Sturgis. And of course, they are going to be out and about in our society, and you're going to be mixing when you go shopping, or maybe when you go to church, or when you go to dine outside in a restaurant. There's going to be people there that potentially have been at Sturgis. So indirectly, these kinds of situations affect us all. So what's the best thing that we can do? Practice those things that we know with vigilance, because we certainly do not want to go the route of some of our colleague organizations in Minnesota where they have had positive cases in the hundreds. And we don't want Minnesota to go the way of some of the states where they've had positive cases 10 times greater than that of Minnesota. That would be very, very problematic for all of us. So we know social distancing, wearing face masks, frequent hand washing, and if you have any symptoms, to self-isolate and get tested promptly. And remember, as I've said many times, as you know, I'm not a research scientist with infectious diseases. I'm not an epidemiologist, but I pay attention to those scientists. I believe in science. I believe in what the most informed, the most educated on the subject have to say. And that is what they're saying, that wearing a face mask, socially distancing, really matters. So that's what we have to be vigilant about. Just yesterday, one of our managers, she told me of a person that works with her husband. She is 36 years old. Last Thursday, so that is only 6 days ago. So 6 days ago, this person was having symptoms. She got tested. On Saturday, it came back positive. She was so sick, she had to immediately go into the hospital. And she was put on a ventilator, she was so sick. And yesterday, Tuesday, she was induced into a coma to try and save her life. So in just 6 days, she went from being healthy, fine, normal, to contracting the virus, getting confirmation of it, on a ventilator, and now in a coma, fighting for her life. 36 years old, 4 children. So that is a most sobering story, and thank goodness that is not typical. That might not happen to you or someone that you know. But there's the vexing part of this. We don't know. We don't know how sick any one person is going to get, and you don't know whether or not you have it right now, because you might not have symptoms at all, or you might not have symptoms yet. I don't know if I have it at this time. So what do we have to do? Protect one another with the precautions that we know. The best vaccine that we have right now, social distancing, wearing a face mask, frequent hand washing. If you have any symptoms, isolate yourself and get tested. So that's what we need to do, all right? We're in this together, which means we've got to take care of one another, one and all right? I look forward to seeing you tomorrow at 1:30. Bye-bye.